Good afternoon, everyone. You are very welcome to the Masculinities and Men's Health Mission is Possible webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host for the day, Lorcan Brennan, Training and Development Manager, Men's Development Network. Thank you.
Thank you very much, Helena, and hello to everybody. And you're very, very welcome, everybody, to our lovely webinar for Men's Health Week. And before I say anything else, can I start by saying, first of all, for Men's Health Week, it's a very, very special week on the island of Ireland. And there's a guy here with us today, he's in the background. He's not out front, he put me out front, but he's called Collie Fowler. And here you can see this, it's Men's Health Week. There you go, it starts today, Mission Impossible, the action starts with you. And it's just a call out right at the very, very beginning to say, if you want to know more about the week, you want to get involved in the week, if you want to get buttons, or if you want to get anything that would help you to celebrate or mark the week in a very special way, please do go to MHFI.org. And there you will find everything you need to make sure that we can start and continue the week with men's health on our mind. So look, you're really, really welcome. This is part of a series of webinars that's going to run till the end of the year. We hope to have another one in the autumn, and then we'll have one, of course, for International Men's Health Week. But to really get the action going, I'm going to ask Helena, would she please play our promo for Men's Health Week, which will probably really launch us off in the right direction. So when you're ready, Helena, it'd be great to see the promo. Delicate button there, folks. Now we're officially launched into Men's Health Week, so I hope that really gets us off the pad. Look at, folks, we're back again. We have the same partners involved for this webinar as we've had for the other ones as well. So I'd like to welcome you on behalf of the HSE, on behalf of the South East Technological University, the Men's Health Forum in Ireland, and ourselves, of course, the Men's Development Network. International Men's Health Week runs in June every week or every year. It's a huge event across many different countries. And to mark it this year, we have some really lovely people who are going to be with us for the next hour and 15 minutes or so. So we hope that you can sit back and join with us as some of the people that we've brought along will tell the story of their own engagement and their own involvement in Men's Health Week, especially. Now, who have we? With a woman called Sonia Montgomery. We'll tell you more about her in a few moments. We have Jim Curran, and we have a man called Paul Ferris as well. And they'll be along, as I say, to share with us and talk with us about their own involvement in Men's Health Week and indeed their own work overall. Fergal, unfortunately, is not with us today. He's usually with us for all our seminars, but just stepping in for Fergal, we'll have Noel Richardson, and people will probably know Noel from his research, from the National Men's Health Policy, from training and development, and from all kinds of things that he's involved in on the island of Ireland. Helene has already mentioned the Q&A bar. If you have any questions you'd like to ask us, please do use the Q&A bar, and then we can take it from there. And we have Collie and Finian in the background, and just keep an eye and they'll move it along for us there. So look, we said we have some lovely people coming along, and I see Sonia's here already with me. She's up there on the screen. And just a little bit about Sonia Montgomery. Sonia is the Health Improvement Manager in Suicide and Mental Health with the Western Health and Social Care Trust. She's a really active promoter of, I suppose, Men's Health Week on the island of Ireland. She has a huge experience in relation to running initiatives and programs and all kinds of different things in relation to men's health. And she's certainly been very, very involved in the background and in the forefront of training and development and capacity building as well up there. And Sonia, it's so lovely to have you here and to be able to share with us some of your work and some of your story in relation to Men's Health Week especially, but indeed all of the work that you're involved with your partners up there. So I give you the screen and go well.
Thank you, Lorcan. It is absolutely lovely to be here. And I'm so glad I'm actually in a position to be able to talk to people today, because I have had the lurgy that's been going around this past couple of weeks that was not COVID, but Anyway, we'll get through it all, so bear with me if I start to get a bit nasally on it again. Okay, so I'm just going to share my screen, and hopefully this will work for you. Can everybody see that okay? Yeah. So, okay. My name is Sonia Montgomery, as Lorcan has said. My day job is suicide prevention and mental health. But what I work towards here in Northern Ireland and in the Western Health and Social Care Trust is the Protect Life 2 suicide prevention and mental health strategy. And I'll tell you a wee bit about that in a minute. Just to let you know that the Western Trust covers quite a substantial geographic location across the northwest of Ireland. And we cover from Limavady across to the Cavan-Monaghan border at Enniskillen. So it's quite a substantial area, and I look after all of that in terms of the work that I do. So why focus on men? Well, for me, the Protect Life 2 strategy and the new, more recently published mental health strategy in Northern Ireland tells me that I have to. Men in Ireland, as we know, die on average almost 4.5 years younger than women. They have a higher death rate at the moment for all of the leading causes of death at all ages and stages in their lives. We are seeing very, very subtle changes in terms of suicide, self-harm and mental health issues with men. Actually, where we used to see a large proportion of younger men being in that mindset, it's now veering towards middle age and early older age as well, which is quite concerning. So there's a lot of work to be done there. And then we've got the vulnerable subpopulations. So those are the likes of men who have learning disabilities, men who identify as LGBTQIA+, men, and this is specifically unique, I suppose, to the area that I work in, men who live in rural areas, because we know there are very, very specific issues that they have in terms of isolation, barriers to accessing services, and the fact that in rural areas, and this goes for the whole of Ireland, they don't really like to talk about what's going on in their head. They're very, very conservative, and we do find that men in more urban populations are more likely to come forward and talk about how they feel. Men specifically from farming families and farming backgrounds may well have access to more lethal means of suicide. For example, if they hold a shotgun, and that's something to always be very, very aware of. And we know from the evidence that there are professional groups of people who are more likely to consider suicide than others. And in terms of rurality, those are farmers and vets. So there are a lot of issues there. The other thing, just to say, to put it in just as an afterthought, and this is really just to give you some idea of the organisation that I work for. So we are health and social care. We come under the health and social care family here in Northern Ireland. Only 20% of our staff in the Western Trust are men. We have an 80-20 split, which is very, very unique and something to be worked with. So what do? We raise awareness. We enable and empower people out there to work with men. What we find is that men won't come forward, and practitioners don't know how to work. So it's like a double-edged sword. They don't know how to approach. They don't know the skills and the techniques. They don't have, well, they think they don't have often the skills to be able to work with men, but actually the training that we do, that we'll talk about now shortly, will prove that actually, yes, they do. Resource development, I'll show you some of the things that we've developed in a moment. We run events to promote men's health and men's mental well-being in particular. We look at promotion, we look at social media, we make full use of our platforms here in the Trust. For me, the big thing is about building the networks and building partnerships and joining the dots so everybody is singing off the same hymn sheet, that everybody is consistent in their messaging. I work really, really closely with Men's Action Network and Men's Health Forum in Ireland to be able to do the work that I do. We have a collaboration of organisations who deliver on men's health here in the West, and that collaboration is known as Men's Health West, and we have a website. The signposting is really important as well, because people need to know where they can signpost men onto to get the help that they need. So very quickly, these are some of the events and the resources that we have done over the past number of years. This was a Hope conference. So one of the big themes, and this is from the Protect Life 2 work that I do, is instilling hope. So it's that strengths-based approach with men. It's instilling hope. It's letting them know that all is not lost, that there is the help out there. So we organised and we ran a conference in 2018 with that theme. Resource development has been very, very big over the years. I did have another colleague, Sandra Semple, who I have to acknowledge, whose expertise was around cancer prevention, and she designed these resources, and we can send these out to anybody who would like them afterwards. In recent times, we've done things like It's Okay Not to Be Okay, and I believe that link is going to be shared with you. That is a Page Tiger resource which signposts men to sources of help for a number of issues and problems that they might encounter in their lives, the likes of housing, the likes of their own health and well-being, where to get support with their mental health, if they're in crisis, where to go, and all of that is contained in that document. Training has been hugely important for us. And we started off the whole training journey, I suppose, with the Engage All Ireland Men's Health programme. And we ran that with 20 trainers, and that allowed us to deliver the training widely across the Western Trust area. So we were able to target somewhere in the region of 200 practitioners who are out working directly with men, and often hard to reach men's groups as well at grassroots level. So what the Engage training showed us very clearly was that there was a massive gap in terms of men's mental health and well-being. So from Engage, what we did was we developed a course, a unique, specific course, hasn't been done before, called Manifest. And Manifest, the definition of Manifest is to make possible. It's a public declaration of your intention. It's what you're going to do. So we felt that Manifest was really, really pertinent as a title for this course. So it's co-produced by the Western Trust Men's Action Network and their service users and the Men's Health Forum in Ireland. And that's my timer just gone. So we'll move on from that. It's a regional approach. What we did was we piloted the course across the whole of Northern Ireland. The other trusts are very, very interested in this, and going forward, they will be involved in its delivery. What we're going to do is, following the successful pilot of this, is we're going to produce a facilitators training program, and that will be developed and launched in 2023. The Manifest Northern Ireland website is under development, and we have loads of material that will be available in that. This Men's Health Week, we're doing loads of stuff. We're working with Groundwork Northern Ireland. They are the umbrella body for the men's sheds. So we have small grants, very kindly funded by the Public Health Agency here in Northern Ireland, which are going out to a number of the men's sheds across the Northwest. And they are going to be delivering lots of lovely things like retreats for men, guided walks for men, complementary therapies, self-care days, all sorts of lovely things. We have a number of health fairs that I am going to be in attendance at this week. We're giving out all the resources, all the man manuals. The Pink Panthers are very unique to Derry. They're a group of male cancer survivors, and they are going to deliver some prevention sessions for male staff in the trust this week as well. So what works in the West, and this is really important. So the fact that we are promoting and building the case constantly all year round, we see Men's Health Week as being the spotlight on everything that we do year round. Raising the awareness, sharing the expertise, as I said, that's a two-way process. Developing the networks and growing them. The strategic direction is hugely important, particularly from those strategies that I mentioned earlier. Identifying the gaps like we did with the men's mental health training, and the financial support from the Public Health Agency. While it's not always necessary, it's lovely to have because it allows us to do so much more. And that regional buy-in from the other trusts has been fabulous. These are my contact details. Lorcan, apologies, I think I've run a couple of minutes over time, but thank you so much for having me here today.
Sonia, that was super. Thank you very, very much. Absolutely super. And you can see the amount of work that you've been involved in, which is really super. And Sonia, you're going to stay with us as well, because in a while we're going to go to the panel and you bring all of that experience. And that's why we wanted you here today. The amount of partnership approach that you take and all those initiatives are just fantastic. So do stay with us and come back to us later on in a while.
Thanks, Lorcan. As you can see, I can talk an awful long time about this stuff.
You're a passionate champion. So that's what
thank you.
Celebrating Men's Health Week. And look, it's a lovely introduction, because after Sonia, we're going in a direction that's quite close to, I suppose, again, still engaging with men. And we have with us the lovely Jim Curran. And Jim is somebody I know over the last number of years. He's the Director of Communications and Strategy with the Irish Pharmacy Union. He's over 20 years experience in relation to management. And I suppose for the last 10 years, you've worked there, Jim, with the Irish Pharmacy Union, and you currently oversee the IPU Communications Department and the strategy. And you're very involved in lots of things, and you're a part of MHFI, and you contribute so much as well across the nation, as I say, especially for Men's Health Week. So Jim, you're really welcome to the stage, and tell us more about your great work, especially in bridging that gap.
Listen, Lorcan, thanks very much for that introduction. Hopefully I'll be able to live up to it now. So I'm just going to share my screen for everybody there to have a look. Everybody see that yet?
Can you pop it into presentation? Thank you, Jim.
There we go. There we go. Listen, Lorcan, thanks again for the introduction. And I'm delighted to be here today to talk about the important role of community pharmacy in promoting men's health and the positive difference that pharmacists can make to men's health. And as Lorcan outlined, I've been involved with the Men's Health Forum now for the last number of years. So you can see firsthand the great work that the likes of Lorcan, Collie, Finian and Noel do on behalf of men's health. It's fantastic work. But I must have talked too much at those meetings, because then they asked me to join the Men's Health Advisory Board, which is tasked with helping to shape and steer the work of the forum. So anyway, for the next few minutes, I want to talk about community pharmacy and our role in assisting and promoting men's health in our communities. And the title I've used for this short presentation is Community Pharmacy Goalkeeper for Men's Health. And why did you use the term goalkeeper? Well, I think pharmacists are a bit like goalkeepers. A goalkeeper's job is to prevent a goal being scored. Likewise, pharmacists, as part of their role, is to prevent patients, including men, from getting ill through advice and support, so therefore preventative care. And I'd also argue as well that, you know, the goalkeeper, while the last line of defense is also the first line, can be used as the first line of an attack, which could subsequently lead to a goal. And pharmacists are often the first point of contact for healthcare setting for men. So there's an analogy there. And anybody who watched the recent Champions League final can see the importance of the goalkeeper to a positive outcome. So what does your pharmacist do? Well, pharmacists are healthcare professionals. They're highly skilled and clinically trained, and they can advise men and boys of all ages on new and existing medicine regimes and medicines that are available on prescription, without prescription. And also, in a lot of cases, men are reluctant to visit the GP to seek advice to treatment. So this is where pharmacists can therefore act as the first point of contact between men and the medical world. And men would often go to a pharmacy, for instance, looking for non-medical items like toiletries and supplements. And this provides us with a fantastic opportunity to discuss health matters with men and to try and support them in relation to their health requirements. Pharmacists also highlight they have a key role in referring red flag and identifying red flag symptoms. And what I mean by that is, for example, I had a pharmacist talking the other day and was telling me that a man went in and he had a skin rash. And as the pharmacist was examining him, he wasn't happy with a mole that he spotted. And then what he did was he advised and referred the patient to the GP. So therefore, the pharmacist can be the link between primary and secondary care providers and can act as a signpost to further healthcare services advice. So whether that's to the GP or to some other healthcare professional. But pharmacists just don't, provide medicines or dispense medicines. A lot of other services they provide, and very briefly just go through some of them. Pharmacists provide vaccination services. We've been providing the flu vaccination for the last number of years. We've also been actively involved in a very successful rollout of the COVID vaccine and the booster. We can provide blood pressure monitoring, cholesterol screening. Pharmacists can also take your BMI, body mass index measurements, and advice on smoking, cessation of smoking, and to give up smoking through NRT advice. But we also give discrete advice for other men's health products. I mean, for example, hair loss products, as you can see, it didn't really work too well for me, but we can give advice on that. Erectile dysfunction, this is an important one. Recently, pharmacists are allowed to provide Viagra without a prescription through pharmacy only. And that's actually helped to increase the engagement between men and pharmacists in relation to having discussions and open discussions generally in relation to health, not just in relation to erectile dysfunction. And pharmacists can also give advice on sexual health. It's very important this, as we can give this advice discreetly, because men don't like to have general conversations or open conversations related to their health. And every pharmacy in the country has a consultation room, which is very private, very discreet, for men to go in and talk to the pharmacist there. So how can pharmacists help men? Well, we support men to engage in healthier lifestyle choices. We support them to remain well. So rather than waiting for men to become sick, we can give them advice, that the healthcare advice and wellness advice, to prevent them getting to that stage, so, which is known as prevention rather than cure. And pharmacists are in a key position to the accessibility of the pharmacies, and have the opportunity then to have simple conversations to start health awareness, which again, in turn, encourages early detection and treatment of health issues in men. So it's very, very important, that whole communication aspect. And also research shows that men generally go into a pharmacy and ask about a product as opposed to the symptom. And it's very, very important that the pharmacist, which they do as part of the job, ensures that that product is safe, that the right product for the man going into the pharmacy. And it's not just, because Tom in the golf club recommended it, that I should get it. There's a process there, a communication process, and the pharmacist go through the details and discuss the issues with the patient, with the man going in. So it's very, very important. We also provide health promotion screening services, and pharmacists can heighten awareness of preventable illnesses in men of all ages. And one of the ways we do that is the IP was actually involved in partnerships with other organisations like the Irish Cancer Society, the Irish Heart Foundation, Mary Keating, where we get involved in partnerships and health promotions and try to promote men's health and look at addressing issues where the pharmacist can be part of that overall prevention in relation to men's health. And finally, pharmacists don't bite. They're very approachable and well used to having confidential conversations with patients. As I said, men generally find it difficult to discuss their health, and the consultation room is there in a private capacity to have those discussions. So how can men access the pharmacy? Well, accessibility. Pharmacies on every high street, every town and village, more or less, in the country. They're open 5 to 6 days, or 6 to 7 days a week in some instances, and have extended opening hours in the evening. Half the population lives within 1 kilometre of a pharmacy, and 85% within 5 kilometres, so it shows the accessibility are there. They're very flexible, and you can simply walk in for pharmacy, or if you want, you can contact them by phone, so they're always there. There's no appointment necessary. So there's an ease there to talk to the pharmacist. And once in a pharmacy, it's generally a non-threatening environment, which is familiar to most people, and there's that relaxed and approachable service provided. And importantly as well, there's no charge for having a chat with a pharmacist. You can go in at any stage and have a chat. If you have a concern about your health, a healthcare issue, you can go in and have a chat there. And again, it comes down to the confidential issue is hugely important. Again, this is where the consultation room comes in. So in essence, I suppose pharmacies have the characteristics that men look for in a service, such as accessibility, flexibility, and informality. And as the stores are local, there's that sense of a non-threatening environment to men, which is hugely important. So very finally, I just want to briefly talk about some of the men's health activities the pharmacies are involved in, including this week. I mean, Men's Health Week, we have a lot of pharmacists around the country are organising free blood pressure monitoring services for men, so look out for that. A lot of pharmacies are involved in cooperation with Men's Shed, and this is really important because we have been cooperating on a consistent basis with Men's Sheds, and the relationship is extremely good, extremely positive, an extremely good way of getting the message out, number one, of what pharmacists can do for men, and looking at the whole area of wellness and that, and how that can assist men, and finding out what the requirements of men are from a healthcare perspective. That's a really, really good cooperation relationship there. As Sonia said, the Men's Health Forum, which we're both members of, have put out fantastic information this week on posters, the Men's Health Manual, etc. And we have been distributing that to our pharmacy network, and that's been really, really useful and really good information for them to have. And I would recommend you go on to the Men's Health Forum website, want this further information, and you can see it all there. PR and social media, like other organisations, we've been actively involved in PR, and we will be actively involved in PR this week, and using social media to get those key messages out with regard to men's health. And then finally, in relation to this week and associated with this week, we are starting an advertising campaign, which will actually begin, if it's not this week, it'll be next week, begin on Monday. But the idea is it's a national radio campaign to try and promote men to go into the pharmacy and use the pharmacy services and highlight the benefits of there. And finally, I just want to very briefly mention a new initiative that we're going to be launching the next number of weeks called Safe Pharmacy. And essentially, this will enable people, both men and women, so it's not gender specific, those who are experiencing domestic abuse and coercive control, to receive support in their local pharmacy. And this has been led by the Irish Pharmacy Union in partnership with Garda Síochána, HSE and Safe Ireland. And this is an initiative we're very, very proud of, and I doubt you'll be hearing more in the next few weeks. So I think, folks, finally, the message is clear that pharmacy is a fantastic resource, and pharmacists are well positioned to discuss any health issues that you have or any issues that men have, and are an accessible, convenient, and in a non-threatening environment. And finally, just taking the theme of this week for Men's Health Week, which is Mission is Possible. What we're saying now is we're saying to men, as your next mission is to visit your local pharmacy if you're feeling under the weather or you're looking for a bit of healthcare advice. So Lorcan, that's me. I know that was a very, very quick run through what pharmacy does, but we have a hugely important service there. And I think it's a resource that's accessible and is available to men. And I would obviously encourage all men out there, if you get the opportunity, you want to discuss healthcare issues, go to your local pharmacy.
Absolutely, Jim. That is a fantastic overview. And I know there's so many people are watching here today, they didn't know the width or the depth or the breadth of what you offer in relation to men and services. And that's why we wanted you here, especially for Men's Health Week, is that bridge between the world of men and other services. And you've said it so really well there for us, and really thanks for coming along. Again, we're going to bring you onto the panel in a while, because there's things we want to tease out in relation to some of what you've said there, but that was absolutely superb. Like Sonia, really, really important information for us for the week that's in. So thank you very, very much.
Thank you. Thanks, Lorcan.
Now, that was really good. I bet you agree with that. Here's where we're going, folks, because it's really interesting that Jim mentioned the goalkeeper being the last part of defence, and probably you can score a goal from it as well. But we're going to bring on somebody to talk to you now and to talk to me, who played wonderfully outfield. His name was Paul Ferris. And Paul, just a remarkable story, really. A footballer, physiotherapist for Newcastle United. He is a writer and author. He was the youngest player at 16 years of age, I think, for Newcastle. And just after 14 matches then, he just had a ligament injury that kind of set things back, Paul, to say the least of it. But that didn't stop you either. You went on actually to lift a trophy in Wembley, not so long afterwards. But over the last number of years, Paul suffered a heart attack in 2013, and he'd written a fantastic book, The Boy in the Shed, which went on to win this Sunday Times Sports Book of the Year. I mean, I can go on at this, Paul, if you want, you know, there's so much. But also then you had, as I say, developed in 2016, also prostate cancer, and you've come back through treatment into recovery out of that. But you're well known for your writing, for your generosity of spirit, for being so much part of, you know, supporting men and championing men's issues and causes. But before even we have a chat ourselves, I think, Helena, will you show us a little bit of a trip down memory lane for a second? It's only very short, but I don't know whether you've seen this, Paul, but somebody dug this out for us, Collie Fowler, I think, and we might show you just in action just for a moment, if that's possible.
The move certainly paid off, as John Anderson's ballooning through ball was touched on by Chris Waddle for the Northern Ireland Youth International to drive in his first senior goal for the club. What a moment for him. 5 minutes later, United gave themselves
What's it like to see that, Paul, after the years? Was that last year?
My son had a look at that last week, that actual video, and said, I can't believe how old the football is. I said, well, it is old. It's nearly 40 years ago. It's very old. It's always good to see it, because at the time, Lorcan, that was me thinking I was on my way to doing that many, many, many times. And at the time, I didn't even pay attention. So it becomes more important the older you get, and becomes more important for your grandkids and things than it does for me. Was my life now, the main things in my life are effectively trying to stay alive, trying to stay healthy as I can, and I'm in a very different place than I was then.
Yeah. Paul, can I go back just a little bit? Not to bring you back too far, but when, you were the youngest player, going out at that age, but before that, a little bit about even making it over there. You were a young man leaving your home and heading off to play football. What was that like for you?
I was a very reluctant footballer. I think I wrote about it in The Boy in the Shed, the first book, about I was the only person in my family and around my teachers, people who really didn't want me to go. I wanted to stay because I met my then girlfriend, who I'm very proud to say is my wife now, still after all these years. But and I was desperate to stay at home, but I was always destined to go. And those first few months were very traumatic. And I think, I'm 16 years old, just sitting the second year of my O levels at the time, and I left school in the September of that year. So, I'm crying myself to sleep at night, and people are saying, "You're a footballer." And I'm thinking, well, I don't feel like a footballer. I feel like a very lonely boy, because I'm miles away from a very big family in Ireland, and England in those days, it seemed an awfully long way away. I felt like you're going to the other end of the world, because there was no mobile phones. There were planes twice a week. You're in digs with a family that's not your family, and it's a very lonely place. And the only thing that went well for me was the football. And so within 6 months, I found myself playing in the first team in May of '82. To give you an idea how young I was, I went home in the June, and my friends from school were sitting there O levels that June, and they're looking at me thinking, you've made it now, you're a footballer. And I'm thinking, I just want to be you. I want to be doing my O levels with you. I want to be home. And that's a story I think is repeated from footballers before my time and after my time too. You go back to people like George Best. Their stories are all the same. It's a really, really big wrench, and a real challenge in your mental health, I think, as a young boy, to be wrenched from everything you know, just to find yourself in a different place because you happen to play football better than your friends.
And tell me, Paul, then, that is a wrench to have to leave home, even though you have this natural ability and natural gift, and then to be the youngest player. That's remarkable. What was that like for you then? Did that make up some of the difference, the fact that you so soon you got in and you started playing professionally? Yeah,
the daytimes were great, because the daytimes you're playing football and everybody's patting you in the back and saying you're going to be fantastic, you're doing really well. The manager was very supportive, the coaches were, your fellow teammates, or so the local press are writing about you. But actually, it's the evenings. Then you go home in the evenings, and the rest of the people are going home to their families or going wherever it is, and you're going back to, in my case, going back to the shop, buying a couple of quid's worth of sweets and stuffing my face in a room in some dig somewhere. And I had another challenge that was a big challenge that I wrote about in the first book, in The Boy in the Shed, was that my mum had a genetic heart condition that I have.
Yeah.
And she'd had 7 heart attacks before I was 12, including 2 cardiac arrests, and it made me a very shy, clingy boy. And I left home at 16, desperate to be with her and to be near her. And I always had that fear that she wouldn't be there, and that was a real challenge for me.
And with your mum afterwards, you recount in the book that you did get home, but again, for herself, she wasn't going to live a long life.
No, and she knew she wasn't. She used to, one of those, maybe I had an Irish mother, the sort of thing they would say. I can remember my mother talking to me all through my childhood, saying, if I can get you to 21, if I can get you up, if I can get you that, I'll be happy with that. If I can get you reared, I'll be happy with that. And actually, rather sadly, she died when I was 21. Whether that's just a coincidence but I always had that fear that she wasn't going to be around, which was that made it. It made it a very stressful time, and that's why I didn't want to go in the first place. But she came across to Newcastle and got to see me play at St James's Park, and got to have those moments which she never would have had in her life, and I know she was very proud of that.
Yeah, Paul, you're a very personable man, and I was talking to you before you came on. You said you generously do this interview for us today, and the thing that stayed with me afterwards said your personability. You're very personable. Was that a help to you in the transitions, for example? Losing your mum, especially, as I said in the introduction, just a few short games, and suddenly you went from the top of the pile to feeling that, you know, your career nearly was over? You know, was your personality a help in relation to coming through some of that, or being able to ask for support as a man or as a young man, or did that come later?
Oh, honestly, Lorcan, it took me to write 2 books. It took me to write The Boy in the Shed, to write really honestly about my life and that. And then I've written and the book about prostate cancer and the magic in the tin. I've actually written to the point where I've written with I think as much honesty as I possibly could have, to the point where I was speaking to my son before I was going to send it off to the publisher and saying, I'm going to read you a chapter of this book about what it's like to be a man with prostate cancer, and we have your prostate removed and all the things that means. And I read it to him and I said, look, is this going to embarrass you? Because if it is, I won't put it out there. But he said, Dad, that's your story and that's how you're feeling. Then you should write it. So when you ask about being a personable person, I was desperately shy and always the person at the back of the room. And it actually took me it's taken me almost to my middle years to find the courage to find my voice. And I write that in some of the books actually for my children. I hope they find theirs a bit earlier than I find mine, because I wanted to do it and I wanted to talk, but actually it took me to write stuff in a book. So then people send me messages. I get messages on Saturday from people to say, I've just read The Magic in the Tin. My goodness, I didn't know you were going through that. And I think, okay, now we can talk because I've written, because now you know everything. And I find that a big release for me. The fact that I've written stuff that maybe I would never have said out loud, but now that it's out there, I have no way back.
Yeah. Well, just the book reviews are just incredible. And for anybody who's watching today, I mean, it's just incredible. I was reading back through some of them again over the weekend. You know, Alan Shearer, All Men Should Read This Book, important and brilliantly written.
Yeah. Well, Lorcan, he's an interesting character for me because he's been a friend for 25 years. But actually, he's from that background of professional football where the alpha male is everything, and he is. If you think of Alan Shearer, he's going to be the biggest one in the room. So he was writing the foreword to The Magic in the Tin about my prostate cancer journey. So I sent him. He got an early copy of it, and he got this guy reading about me having my prostate removed and what it means for my life with my wife, for the intimacy we no longer have and will never have, and we have to find a new way to be. What it's like to be incontinent as a middle-aged man. What it's like not to, you know. I won't put people off their food with this. So the side effects of the treatment have been huge for me. And he read the book, and he came back and he sent me a message, and the message just came back, and the message just said, "This is bloody brilliant, man." Like in his Geordie accent. I thought, well, if I get someone like him and he's responded in that way, then other men will respond in the right way, because he comes from that, you know, that football background, which is a really harsh background where men are taught to be men and not to show any weakness. And The Magic in the Tin is very much about a man saying, I'm vulnerable here. I'm struggling to make sense of what's happened to me here. I'm a bit bewildered. And to get his response was great.
Can I ask you this, Paul, in the context of sport, when you're speaking about coming from such a sporting background as well, is it a really challenging place for, you know, to acknowledge any kind of vulnerability as a man? Or did you find peer support, or did you find, as you said, Alan Shearer, a great friend? You know, is there a hidden friendship behind maybe the competition that can be very much part of the higher ends of sport?
I think there was a friendship there with him because I wasn't a challenge to him. If I'm being honest, I was a physiotherapist and I was looking after him, and I was looking after him in a vulnerable time for him. Yeah. So you get a chance where you spend eight months with each other every day. Then you develop something that goes beyond football, which we did do many years ago, and that stayed with us. The short answer is I don't think it's a very supportive environment. I've been out of it now for 10 years, but when I was there in the early 80s, it was very far from being supportive. It was a pretty harsh place to be. When I went back in the 90s, and there was much more sports science coming in, psychology coming in, there was a lot of help there. Whether men availed of it, I don't know, and I only have a very deeply personal experience. Gary Speed was a very good friend of mine at Newcastle United. He was a very intelligent boy. He was a handsome boy. He was a wealthy man. He had everything, a lovely family man. You know, he hanged himself. You know, and the day he hanged himself, Alan Shearer rang me and said, "Gary's dead." And I said, "Has he had a crash?" He said, "No, he's killed himself." And I said, He can't have. How can he have?" So, and I was someone who was in a position to be supportive, and I couldn't get to that, or no one could get to that, because the environment just didn't lend itself to that. And if I showed you Gary Speed at in a football changing room, there just was no sign that would be that, because I don't think the environment was there for him to show it.
Speaking about something as sad as you've just mentioned, you know, around suicide, you've spoken about prostate cancer, you've spoken about your heart attack. You know, there are a lot of really very difficult issues, and there's men maybe watching even today, or there's men that we know, and as a champion now yourself, Paul, in relation to men's health, what would you say to a man that maybe struggles with the vulnerability to be vulnerable, you know, that he's not able to make that phone call or get to that service? What word of encouragement would you, I know you're going to stay with us because we'll move over to Jim and Johnny in a moment, but what word of encouragement would you give to that man to try and find his voice around getting to the supports and services he needs, especially Men's Health Week this week especially?
I think it's okay not to be fine. So I was 48 and had a heart attack. I wouldn't make a heart attack, survived, but psychologically was damaged by it, clearly. And then I had prostate cancer three years later, and for a little while I was hard to live with for my family, because I'm thinking, why me? Why is this happening? This is. And then I thought, actually, no one's gonna help me genuinely if I don't take a wee step myself and try just a small step. And I remember having a conversation with my wife, who'd been my partner for a long time, and saying, you know, I'm struggling here. And she said, what way? And I told her, and she said, oh, well, I didn't realize. Well, you need to take a step and take some help. So as any man out there that is facing traumas in this life, or face whatever it is, there's two things I would say. One is, you know, don't be frightened to take responsibility, to take the first step, to go and see someone. People want to help. People definitely want to help. And once you take that first step and you open the door, then you've opened the door, and you're on another journey. So if you're on a pathway you don't want to be on, you know, open a doorway to another one, and you're on another journey.
Well, that's a lovely place just to end this part, but I'm asking you to stay with us for our panel, you know, to take that one step and open the door, because that's what we're going to do. And we're going to ask Sonia is going to come back to us. But before we go there, just I really appreciate you coming to be with us today. And both of your books are there, The Boy on the Shed, and as I said, The Magic in the Tin. They're just really worth going to get a copy of anybody interested. As I say, every man, every person should read them. But we haven't that long. We have a little bit of time for the panel as well, Paul. So please do stay with us. And as I say, Jim is back with us, Sonia is back, and Noel is here with us as well. Noel Richardson has joined us as well. So Noel, thank you very much, everybody. You're there, everybody together.
Thank you. So
before we go to the next part, folks, Paul has spoken really powerfully about some of the challenges that are there for us as men, and especially in the context of Men's Health Week. That's really, really important and honest. And there in the chat bar, you'll see it as well, there's lots of information and resources if people need to find out more information in relation to anything we've talked about. It's really important, as Paul has said, you know, to open that door, take the first step, and find the resources and the supports that we need. That's really, really important. But in Ireland especially, can we just say that, you know, men's health is not a greenfield site. And just before we have our discussion, we're going to watch just a very short video, and I ask you to sit back and have a watch, because it will show you over the last probably 20 years especially what the journey has been like. There's lots of work to be done, as Paul has already said, but some things have been achieved. And I think this week is a good week just to mark that and see what has been going on. So Helena, if you can maybe share the video in relation to saying that we're not on just a greenfield site, it would be great. Males constitute almost 50% of the population on the island of Ireland, and therefore deserve to have a gender lens focused upon their specific health needs. Research shows that men experience a disproportionate burden of ill health and die too young. Males have higher death rates than females for almost all leading causes of death and at all ages. Poor lifestyles are responsible for a high proportion of chronic diseases. And late presentations to health services can lead to a large number of problems becoming untreatable. Indeed, while many of these conditions are preventable, their prevalence amongst men may in fact rise in the future. However, this is not a lost cause. much can be and is being done to improve this situation. Men's health work on the island of Ireland is not a greenfield site. Solid foundations already exist. A wide range of innovative and positive work has already taken place to support the health needs of men and boys. For example, Ireland was the first country in the world to have a national men's health policy, which was succeeded by a dedicated Healthy Ireland Men's Action Plan, which is in itself being reviewed and updated. The Engage Men's Health training programme has influenced how services and structures support males, but many other pioneering approaches have been developed and tested which provide models for improving men's health. Some of the work to date has included policy and action plans, research, statistics, resource development and training, demonstration models, national campaigns, the workplace, providing toolkits for engaging men, posters and promotion materials, networks and men's gatherings. Yes, much has been achieved, but there is still room for more. Hopefully, the years ahead will provide many ongoing opportunities for the improvement of men's health through creative partnerships, initiatives, research, training, and policy. Yes, folks, some of the pieces that we've seen there, you know, some things done and more to do. Noel, if you don't mind me asking you, maybe you can come off your mute there, all of you, and we'll just have a chat and move around. When you watch the video, Noel, in the context of this week, and we've listened to Paul and Sonia and Jim as well, around being part of, you know, I suppose promoting men's health on the island of Ireland, you know, what stays with you from seeing the video that's positive in relation to where we are at the moment?
Well, there's lots, Lorcan, but I think the point you made about using strengths-based approaches to engage men is really important. And when we look at a number of the programs that the HSE has supported on men's health over the last number of years, programs like Farmers of Hearts, Men in the Move, Sheds for Life, and Firm Ground, and others, it's not starting from a deficit model. It's starting from not seeing men as a problem, but seeing what are the challenges and how can we use the creative partnerships that you spoke about. How can we engage men from a strengths-based perspective using positive models of working? And that for me has been the overarching theme or success of our work. And I say our work because it has been a collective effort through not just the HSE, but through the research partners, community voluntary sector partners, statutory organisations, all working in collaboration with one goal in mind, that being to promote men's health, and to promote men's health in sectors that traditionally might have been seen as very challenging, you know, say farmers or older men, who would traditionally have been seen as probably what we might call hard to reach. But we've seen through these programs that when men are engaged in the right manner, the floodgates open, and you know, they will engage brilliantly with the work. Yeah.
And Sonia, you were making the same point probably as Noel earlier on. You know, partnerships, it's been the only show in town in your own work.
Absolutely, Lorcan. There is no way that and that's why I'm always very aware whenever I present, it's we, but there's a reason for that. I couldn't do this by myself. It has to be a partnership approach. And the other thing to say is I am not an expert, and I would never profess to be an expert in men's health. I feel I've become more expert, but that's through the partners that I have worked with over the years to build this work up. So the likes of Men's Action Network, Men's Health Forum in Ireland, service users themselves. I mean, I have met some truly inspirational men over the years, and that has helped me grow the work that I deliver on here in the Northwest.
And can I stay with you, Sonia, for a moment, because Paul is beside you there on my screen, and you know, champions and identifying champions in health or in vulnerability, that's really, really important. The more we can call each other out as men, yeah, and invite each other out to be champions in relation to men's health, that's really important, isn't it?
Yeah, it's hugely important. And do you know what? There's a video that's going out hopefully today in our social media, and it was actually made for last Men's Health Week. But it's two guys, one's a barber and the other's a customer in the chair. And the guy actually is a barber here in Derry. But they're talking about the importance of talking about your mental health. And you know, what it reminded me of was the Lions Collective of Barbers, which is, it's basically a global entity where barbers can sign up and become, I suppose, part of the whole mental health suicide prevention conversation. And they receive training. They become experts in their own right at listening to what the person in the chair is saying and going, right, okay, I hear you saying that. Do you need some help? And they will be in a very unique position to signpost them on to expert and professional help. And things like that, you know, they are growing exponentially. There's such a massive approach out there in terms of training up people like taxi drivers, training up very key groups of people who can be champions in terms of men's health.
And that's the future, I think, for all.
That is the future, yeah.
Jim, you spoke very powerfully about your own engagement with, the community chemist approach. Being involved in Men's Health yourselves, how important has that been for Men's Health Week especially? You've done so much promotion over the last number of years across the country.
Yeah, Lorcan, from our perspective, it's hugely important. But I think there's an important thing here to say. We're talking about 1 week, which is men's health, which there's a focus on. But men's health is 52 weeks a year, as we all know. And there's fantastic work being done out there for the rest of the year. But even having that 1 week gives a focus. It gives a focus from a media perspective. It gives a focus for local community perspective. It gives a focus then for healthcare and healthcare providers, including pharmacies. And from us, as you can see, we've used the week to promote the services of pharmacists, and we're unashamedly doing that because we think we have a key role to play in men's health. But a lot of, let me put it this way, if you look at those who go to a pharmacy, 1 in 3 are men. So predominantly it's women that go to the pharmacy. But does that mean that men have less health issues than women? Of course they don't. Or sometimes what men do is they might send a wife or the girlfriend in to get advice in relation to it. What we're saying here is that, listen, there's an accessibility here.
Yes.
We're on your doorstep, and it's using the week like this to, I suppose, educate our own members as well, to try and get the message out because they have a good story to tell. And the other side of that as well is to get our own, get our own message in relation to what we can provide locally for men's health and how we can assist men's health and improve men's health. But the key thing here as well is that the signposting, and Sonia mentioned it there as well, signposting is hugely important. And as I said, the pharmacy can be the first point of contact in medical care, and there's a huge role, and pharmacies are playing a huge role in, first of all, helping to identify health issues and signpost and move men on to different healthcare professionals where required. And secondly, is very important, is the whole health and wellness thing. Pharmacy has a huge role to prevent illness and to assist men and give them advice in relation to looking after their own health.
Paul, just coming off what Jim is saying, it's just prompted something in me. And you said about reading that passage, I think, to your son from the book. For younger men, and we're looking at ourselves at a demographic, and we won't add up our ages here, but for the younger men coming after us, is there a shift, is there a change in relation to maybe their openness to be aware of health and wellness, and maybe use services that Sonia is talking about or Jim is talking, would be more likely to go to the chemist and say, check it out, or talk to somebody? What's your experience?
I absolutely think that we are damned by our age in terms of this. I think younger people are much, when I looked at my boys and how they talk much more openly about things than I ever would have done, and I ever would have been brought up to do. And just something that some of you guys were talking about there before, and some of the stuff, it's brilliant to hear those things are all there for people. But I was writing in the second book about really struggling with the side effects of prostate cancer and what it did to me as a man, and trying to find a new way to be, and sitting in front of an oncologist who was the nicest man I've dealt with through this whole journey, who was becoming my friend. And he actually said to me, how are you doing? And every part of me wanted to say, you know what, I'm struggling a bit here. And I'm an intelligent person. I wanted to say it, And I still didn't say it. I said, I'm fine.
Yeah.
And I write, I'm fine. You think, no, I'm anything but fine. I'm far from fine. It's just hoping that, and just getting the message out there for the men themselves, that there is a role that we play in this as well. You have to ask for the help. You can't just, it has, you guys can put everything in place for us, but actually, I think, when you've been dealt a blow, and a big blow, it's okay to be vulnerable. It's okay to say, I'm not fine.
Yeah. That's a really, really good point, Where do we find resilience, folks? Where, you're talking, Paul, about that. What does resilience look like for us? Maybe, Noel, if you were to, in the context of, identifying what Paul has said there, vulnerability, we still struggle with some of the messages we pick up as boys and men around acknowledging vulnerability is a real part of our lives, and very often the stepping stone into something much richer and better. But we hide behind it. How can we get that?
I think the links between resilience and masculinity are such that a lot of men assume that resilience is about being strong and autonomous and handling things in a manly kind of way. But really, the essence of resilience is exactly what Paul has talked about there. And he phrased it beautifully, like it's in 5 or 6 short words. It's okay not to be fine. And that is the essence of resilience. I mean, if you get to that point and you acknowledge that deep within yourself, that vulnerability. And I've had this challenge with Parkinson's disease for 10 or 12 years. And in the first few years, I mean, I struggled with those words as well. But now when I go into a room, I like to put it out there because, it gives a context to the way I am in the world now that's easier to have out there than not. But that's where it starts. So I'll repeat, Paul, if you don't mind repeating your words of wisdom. It's okay not to be fine. And once we get to that point, then exactly what Paul has said, that's the first step. It opens the door for being offered support from others, being able to tap into that support. And there's great freedom in that. There's great power in that. And that's the essence of resilience for me.
It's really good. It's a great line, Jim. I think I've campaigned there for you. It's okay not to be fine. Could be in your windows all over Ireland, and come in and talk to us. What do you think?
Yeah, I've just actually written those words down with my communication hat on, and I absolutely agree with the two guys in relation to the whole issue of resilience. I think what's important as well from men's perspective is sometimes we have to acknowledge and use the term that we're human. Sometimes we've acknowledged there's issues around us. And just give an example, to be honest, I mean, any advice I would have is if you have an appointment for healthcare for whatever reason, make sure you don't miss it. Because I know from a personal experience, I missed an appointment years ago. I was lucky enough to get another one quickly, but that made a huge difference for me at that particular time with a particular illness I have. And sometimes we just have to acknowledge, that we can get sick, that we can have issues, and that we do need to seek advice and we do need to seek help. And I think that's the key thing, is admitting you need to seek help, and actually take the steps to getting it.
Yeah.
Lorcan, just add one more point to this about resilience. We talked earlier about the importance of champions, and really all men and women are champions of men's health potentially, because we've seen this with the programs in men's sheds, where we've seen really, really great peer support happening within the shed in a way that helps normalize conversations about health within the shed, thereby making it much easier for men to maybe express vulnerability, because it's not a rigid, toxic environment, where men are shown to be weak if they open up about a problem. So I think Paul's story resonates all the more acutely then, because he's an average bloke, Paul, if we could call you that, who's telling his story, and there's a real integrity and there's real genuineness about the story that any man can relate to, and that's a much more powerful message than anything that comes from a health professional. Or, I mean, it's really important to have health professionals on board as well, obviously, but men sharing the stories with other men, that's a real magic formula for getting men more tuned into their health, I think.
Really super. Well said, Noel. he's pointed at you there, Paul, so I'm going to ask you to ask another question if you don't mind. It's very simply this, in the context of your own incredible journey that you're still on, you know, what is your wish for men? What is your wish for men in relation to our health and well-being? What does it feel like or look like when you see it? If we're going forward for Men's Health Week, if there's a word of, you know, optimism for all of us, what's the wish?
I can only speak of my own journey, and the thing that surprised me about both books, Lorcan, and it still surprises me. You mentioned the reviews of the book. The thing that I get back from the book most is people saying, that was told with great honesty, or that was told with that's very raw, or that's brutal, or that's, you know. And I'd like it to be able to step away from a man describing living with the side effects of prostate cancer as having to be brutal. It's not brutal. It's just the reality of what's happened in my life, as Noel touched on before. And you put your Parkinson's out there. Noel, once you, this is the life I'm leading now, and I'd rather be in a room with people who understood what I'm going through than me hiding it from people and pretending I'm who I was when I was 25 years old. I think there's pain in that. Whereas actually there's great freedom in what people say is a brutal telling of your story, because I don't think it needs to be brutal, Lorcan. And I think, you know, having prostate cancer at 51, having your prostate removed, dealing with all the things you talk about, erectile dysfunction, incontinence, you know, penile shrinkage, the things that maybe men just don't. What man wants to talk about that? Me, obviously, but I'm just saying I just want men to be, if we could just get over our childhoods a little bit and perhaps respond to what you guys are saying and just be a bit more honest with ourselves. And I'll go back to what I said. If you're not happy and you're not content and you are hurting, there's no point in internalizing it all. You may as well share it with someone. You may as well share it with your wife or your friend or your partner or whoever that might be, because it really helps. And in my case, writing 2 books, I've actually, the 2 biggest achievements in my life, I believe, are those 2 books that you talked about. They happened at my time of supposed ill health and when life is supposed to be not so good. So 2 great things that come out of it, and me finding my voice because I've had ill health. I hope other men can find theirs too.
So to help us find our voice, how we can find our voice, it's super. Well said. Sonia, can I ask you this, please? We're running on time here, but this is really important. When we had the original piece of research that Noel was involved in, I think was Getting Inside Men's Health, and we asked men in relation to their mental health, who would they talk to? And I was only looking at this very recently again. I think, Noel, it was 87.6% of us, a really incredibly high number, said we would talk to our wife or sister or some woman who was close to us in our lives. You're a champion, you know, in relation to working in the area for men's health as well, you know. As a woman working in the area, you know, your role is so vital as well as championing with us and on behalf of us, on behalf of our dads and our brothers. Do you agree? I hope you do.
I absolutely agree, Lorcan. You know, at the end of the day, it's all about having a trusted other person. And do you know what? We're living in a really diverse, changing society. And that might not be your wife, it might not be your daughter, because you might not be in that position. But if you have a trusted individual that you can confide in, for me, you know, I've been listening to everybody else, and the whole theme here is communication and communicating and getting it out there. That is so much more helpful than keeping it bottled up. And we've all alluded to that, you know, so that if there's somebody that you can talk to, if there's somebody that you can just say, come here a minute, have you got 5 minutes for a cup of coffee? I'd just like to have a chat with you. You know, rather, as soon as you get it out there, it frees you. You know, and Paul said it there, and that is 100% right. So yeah, as a woman, I would definitely be saying, talk to somebody, talk to anybody, as long as you know them and trust them. And we say this to all population groups, from cradle to grave: trusted individual, talk to them, get it out there, and then hopefully they will be able to find you the help that you need, or signpost you on.
Lorcan, if I could come in there as well, because
please do, yeah.
I think it would be really interesting to repeat that question now, almost 20 years on, because I think Sonia's point is critical there. It's about that trust. It's about having confidence in somebody that you can talk to, whether that's a man or a woman. I don't think is the important issue. It's the trust and having a kind of sense of safety to share vulnerability is the really important bit. And I think a lot has happened in that 20 years. I think, you know, there's been a lot of men's health advocates over that time, men and women who've done a lot about destigmatizing, say, mental health issues, normalizing conversations about health. So I think and Paul alluded to this as well with younger men, there is more of an openness now among men to share problems. So hopefully we've moved beyond that in the 20 years.
Very good. Finally, I'm just going to ask Jim. Come in, Jim. Yeah, say what you want.
Sorry, I was just going to say there as well. Well, do you remember the old slogan, "It's good to talk"? I think that's very, very, very apt here. The other thing as well, I think is important as well, is taking responsibility for your health. The whole concept. I think Sonia mentioned it, self-care, which is really, really important. And self-care doesn't mean you want a doctor to go to Google. So don't start me on that and get the advice there and move on. But you can bring in self-care and look after your own health and wellness with the cooperation of somebody like a healthcare professional or a pharmacist that's there. So it's really about taking responsibility for our own health and getting that advice and getting the wherewithal to be able to recognize this and look after your own health. So I think self-care is a big, hugely important area that needs to be promoted more and addressed more, particularly with men's health moving forward.
Folks, I'm just really conscious, and Jim, that's a really good place to finish. We're running on time here, but look, it was an amazing set of presentations, and Paul, your conversation as well was just really, really supportive. I hear people listening when you were speaking, and Noel to come in and join us as well with your experience has been really fantastic. It is Men's Health Week, folks. We've talked about a lot of different issues that are part of the reality of men's lives. It's a week where we mark it. It's 52 weeks in the year is about men's health, though. It's really important that we keep that in mind as well. As I said, a lot of what maybe we talked about, there's information there. And I love Jim, and I think Paul said the same. Just go get the supports that we need. That's the best thing we can do in relation to marking Men's Health and Men's Health Week in a significant and a specific way. And as I said, the poster you saw there earlier, we are saying optimistically, mission is possible. And the action does start with you. It starts with each of us individually and collectively in trying to make a difference in our services. I'm going to say goodbye to Sonia and to Jim and especially to Paul. And I'm going to hand over to Noel to say goodbye to us. And there's a few little bits of business to do. But thank you very much, everybody, for being with us. And it's really been lovely having this hour just to have such an important conversation on this week. So go well, everybody. Noel.
Thanks, Lorcan.
Thank you, Lorcan. I'll be very brief, really. I'd just like to thank the guys for their wonderful presentations, including the chat we had there for the last 15, 20 minutes. It's been really, really useful, I think, for people who've signed up for today's webinar. I'd also like to thank those that joined us in today's webinar and for showing the interest. And I'd ask you to continue to promote Men's Health Week within your own communities and your own organizations. And especially by posting on the daily themes, which are up on the Men's Health Forum in Ireland website, mhfi.org. I'd also encourage you to use the hashtag Men's Health Week on all of your social media postings. Colin has done great work over the last weeks and months getting the men's health manuals out there, so please try and circulate those within your communities and organizations as much as possible. And there's also the online game Agent Man, so we encourage men and women and boys and girls to play that game as well. So just to conclude then, I think it's really important that to acknowledge the HSE's huge interest and role it's played in Men's Health Week over the years. Lorcan mentioned earlier through the video that Ireland was the first country to develop a national men's health policy, and Men's Health Week has been a key action point under that policy. And promoting key messages around men's health has been a hugely important factor in that action plan for men's health over the last 10 or 15 years. So I just want to acknowledge the HSE roles in that regard. And finally, I think I'll give the last word again to what I picked up as the key messages here today. It's okay not to be fine. That's a message that every man should really understand and be comfortable with as far as possible, and that's the first step to recovery and to building resilience, as we talked about earlier, and that opens the door for welcoming in support and help with problems rather than having things fester. So once again, enjoy Men's Health Week. Today is the first day of it. It ends next Sunday with Father's Day. I wish you a really great week. It is a celebration. It's acknowledging all of the roles and responsibilities that men have. So it's a celebration. It's not about identifying problems necessarily. So I wish you the very best with Men's Health Week. Have a great week. Thank you.